Awesome, awesome. Good afternoon. Good afternoon. We are absolutely excited once again to be here. Facebook Live, our Live Healthy Miami Gardens weekly segment. I am Dr. Cheryl Coleman, not a stranger to you, and I'm grateful to be here once again. CEO of Abundant Living Health and Wellness Resulting Services, a partner of Live Healthy Miami Gardens, and also privileged to sit on our health council. And so we're grateful today as we are starting, as you know, and if you don't know, if this is your first time joining us today, the Live Healthy Facebook Live. This is a weekly health and wellness series that's brought to you by the City of Miami Gardens, the Live Healthy Miami Gardens Initiative. And the whole goal of this beautiful time that we have together is for our community to get information and resources to help them to make healthier choices for themselves and for their families, ultimately creating a wonderful place where we can live, work, and play and be healthy as we can be. And with that shared, today we have a special guest that's going to be with us. Our topic is centered on mind versus body, how our health is affected, mental health, if you will, is affected in conjunction with our heart health. This is our Heart Health Month. And so we're excited. Our guest today is going to be Dr. Hector Rivera, and we are grateful for his presence here today. He's the Associate Director of the Interventional Cardiology at Jackson Memorial Hospital North. And we're excited. For those of you who are with us, let's give him a warm Live Healthy Miami Gardens welcome. We're going to let him tell you a little bit about himself, and we're going to give him space to do what he does best. All righty. We're handing it over to you, Dr. Rivera.
Thank you, Dr. Coleman. I'm extremely blessed to be here today. It's a privilege, and thank you for the community for taking the moment to look at this series. And hopefully, this will be helpful to each one of you or a family member. And we're here to serve our community, so please feel free to reach out to us if we can be of any service. I'm Hector Fabio Rivera. I'm a Colombian of origin nationality. I'm a U.S. citizen, proud U.S. citizen now. And I'm here at Jackson North Medical Center. I have the extreme privilege to be able to serve our community here in interventional cardiology, general cardiology, and also have my background for internal medicine. This topic that we're going to be discussing today of mind versus body, the how mental health affects cardiovascular health, I think is very close to me and to many of us, where many of us have seen not only our own health at times be disrupted, or mental or physical, and that of family members. So it is a very important topic. So with that, I would like to go ahead and get started to show you. We're going to start with some slides here and to kind of guide us through what we're going to be discussing. And overall, the way I would like to approach this topic is to take a look and discuss the interaction of mind, heart, body, and how these things kind of interrelate and coexist, because they're really not separate entities, although typically and constantly we've also always kind of treated them as they were separate. In reality, they go hand in hand, and each one will have an effect of another, as we're going to see in the following discussion and slides. We're going to go over an overview of how the mind may affect the heart and an overview of how the heart can affect the mind as well. Here you can see as how does the heart health impact mental health? Well, it can affect it in many ways. Having a stroke, heart failure, for example, which means that the heart is weak and unable to pump at its regular rate or be able to provide the sufficient blood to the rest of the body, or having some things such as metabolic disorder, meaning hypertension, obesity, diabetes, prediabetes, or coronary artery calcification or disease, or having heart attacks that affect our population and all of us, can affect an individual's mental health by causing depression, anxiety, fear of health, fear of disability, the impact that it may have on their social life, and also the socioeconomic impact that this can have. So there's a big repercussion that not only cardiac disease, but any other disease that each one of the individuals of our community can have can impact the mental health of them. So it's important to have a support structure, support group, family members, friends, loved ones that can guide you through this process if needed, and have healthcare providers that are available and conscious of this, so that way they can guide you into this process. But there's also an addition of series of other things that we can do as individuals to promote our not only our physical health but our mental health as well. You can also see that, and again, we're going to discuss this a little bit later, but anxiety, depression, chronic stress, post-traumatic disorders not only can be caused by these things, by having heart failure, strokes, metabolic syndrome, but also can be in certain ways causing some of these different health issues that we have, by causing pain, fear, increased cardiac reactivity, reduced blood pressure, causing hypertension, right? Causing you to be tachycardic the majority of the times because of the anxiety that you're feeling, can also cause your heart to deteriorate with a prolonged period of time. Because remember, the heart never stops. The heart pumps from the moment you're born until the moment you cease to live. And it pumps throughout the whole day, no matter what you're doing, if you're sleeping or you're awake. So, what screening measures can be used to assess psychological health status for patients with or at risk for cardiovascular disease? And the question is, what tests can patients request? I think this is a phenomenal question. I think that there is no straight answer for it, unfortunately, because at the end of the day, what I want you to focus on, it shouldn't be a one test fits all. Each individual should be taken in consideration as a whole individual, with all the risk factors that they might have, with the way they eat, the way they exercise, the social stressors that they're placed into, the food that they have for intake, for example, canned food versus processed food versus more organic food. And not only that, but also your genetic predispositions. So having genetic predispositions can put you at higher risk for health, right? So although there are things like nuclear medicine stress tests, exercise stress tests, echocardiogram stress tests, EKGs, blood work that we can do, cholesterol, renal function, hemoglobin A1C, there's many types of tests that we can do in medicine. I don't want the focus to be on those individual tests, but more what is appropriate for the individual. So it all depends. For example, if you are an individual with hypertension, diabetes, and you're telling me you're having chest discomfort, I'm going to have to characterize what's the type of chest discomfort that you're having and say, this is the probability of you having coronary artery disease or any other condition. And based on that, I'm going to choose the most appropriate test. Okay. And that has to start with a good history taking and a good examination of each individual, and take into account each one of the risk factors that they have to be able to decide what are going to be the next best steps. For mental health, we do have screening tests that we can use as well. Just like I mentioned, some of the screening tests that we can use for cardiovascular, let's say, disease, mental health disease, the PHQ-2, PHQ-9, which stands for Patient Health Questionnaires 2 and Health Questionnaires 9, which are kind of screening tools that we can use on individuals to say you have a higher likelihood of having depression, for example, if you're positive with the 2, and then we would apply the 9, the questionnaire 9, or other types of questionnaires depending on the age group as geriatric questionnaires. So again, to answer this question, it's a great question. It should be individualized to each person based on the risk factors, the conditions, social conditions, life, everything that they have surrounding them. So discuss the mind, heart, body connection. And that's the third question here. And I'm kind of trying to go through all these to make sure that we can reach each one of the points that we wanted to discuss. But if you look at it from a metaphysics standpoint, the mind-body connection is made through the heart. The thoughts we think in our mind and the emotions we feel in the heart give form and substance to the physical reality we experience as life. What does that tell you? It tells me that everything is interconnected. There's no one thing that's isolated. It's like watching a movie that is silent. The sound adds the sound effects, adds the terror, the emotions, the love, and all these things are interconnected, just like our mind and our heart and our body are. So we can't really isolate these things, and we have to have in consideration that how one thing is affected can actually affect and cause a chain effect on the others, either causing what we call negative feedback or a positive feedback to promote health, or negative in this case, which would cause more deterioration in each individual. And if you look at the slide, you can see psychological health and mind here in the purple in the top. And if we have good psychological health and healthy mind, that can affect negative processes and take those things out. So by decreasing stress, pessimism that the patient might have, even sometimes initiation of smoking due to a poor mental health or condition that the patient might have, physical inactivity. When you're maybe sad, depressed, you don't want to really do anything, right? So by promoting exercise, healthy lifestyle, healthier eating, and avoiding poor and overeating and weight gain, and increasing medication compliance, we can improve the cardiovascular health in our individuals. At the end, all this will have even a better or beneficial process on the psychological and mental well-being of each individual by having happiness, optimism, increased physical activity, increased quality of life, because at the end of the day, that's what we want to promote, quality of life in each individual. And it's not just the amount of days that we live, it's how we live those days out. Biological processes, you can see how the detrimental process, the beneficial process can actually affect the body in different ways by lowering your blood pressure, lowering your heart rate, decreasing inflammatory process, and lowering your cholesterol. Can heart failure cause brain fog? Yes, it can, most certainly. It has been documented in some of the studies that it could actually cause brain fog. And so one of the things that they actually, more importantly, that they recommend doing is, one, we should be optimal guideline medical therapy for heart failure, which is a series of medications that the cardiologist would put you on to ensure that we target three things: volume status in your body, your heart rate, and your blood pressure. But not only should we focus on these things, but also on your mental well-being, and things that we can do to improve that are, according to some of the studies, is actually engaging and exercising your brain and your body, doing physical activity, walking, and getting involved in activities. All these things will help us improve that brain fog that you might be presenting with. Are there any mental signs of heart disease? And it's a great question. And for mental signs of heart disease, it can present in many ways. And if we go back to that first comments that I made, you saw depression, anxiety, fear, right? Fear of disability, fear of losing your either economic status or social status because you're unable to perform a job at this point, right? So we have a lot of patients, for example, that have heart failure pretty advanced, and they have to have a change in lifestyle, where before they were able to work in construction, sometimes they have to take more of a back role, more administrative role, as to being more lifting weights and things like that. But again, the idea is to try to get these individuals as healthy as possible and work on the different aspects that are affecting them, not only the cardiac, but also the mental as well. So discuss negative psychological health and cardiovascular disease. Again, these are all interconnected. So we want a healthy mental status. If our cardiovascular status is actually, or we have cardiovascular disease or any other form of disease in the heart, we want to try to make sure that we optimize each one of these as much as possible by doing different things, either putting the individuals on the correct medications and optimizing these, but also making sure that they're happy, that they're exercising, that they're walking. Many times when I have my patients that have heart failure and I see them in clinic, I urge them to exercise on a daily basis, to at least start walking every day for about 10 minutes. And then every week or every 2 weeks, start incrementing by 2-3 minutes. I don't want them starting off and trying to do a marathon right away, but start building up some of that resistance, start building up that mental well-being. And it helps them, because not only a lot of times what I ask them to do is take your partner with you, take your significant other, make it an activity for both of you. And that way it promotes their health as well. And it makes it easier for them to continue doing these kind of things by setting new standards. Are people suffering from post-traumatic disorder at high risk of heart disease? And this is another very good question. These are great questions. And what effect do anxiety, depression have on the heart health? I think we can, although they are very different things, post-traumatic stress disorder can be presented for many things. And the majority of us, when we think about this, we always think about PTSD associated to a war, for example, Vietnam, any of the wars that we've had through our centuries, and how these individuals respond to that and to the experiences that they lived. Um, but there can be also types of post-traumatic disorders to that of um, for example, rape, other things like abusive relationships, things like that, that can also trigger other things. So we have to be conscientious about these things. And these individuals, by having this PTSD, it has been shown, for example, in patients from veterans, that they do have a higher likelihood at times of core cardiovascular disease because they have PTSD. Same thing, individuals with have anxiety and depression, there's a little bit higher likelihood, some of the studies have shown, that they will have heart disease and coronary disease. Why? Increased blood pressure, heart rate, and all these things can affect the heart with a good amount of time. How does higher emotional vitality help with heart health? And that's a great question as well, because higher emotional vitality is going to help us in all individuals to be able to respond to these physical stressors that they might be living from that of the heart disease or anything else. And the way they actually term emotional vitality, it's been used to characterize an individual's emotional response to adjusting to life with a chronic illness or an injury. So, meaning the more positive you are, the better you're going to be doing. The more negative you are, the less well you're going to be doing. And I've seen that in my career. I've seen patients in a career and personal life, individuals that might have the same illness, but one is more positive than another. The quality of life is going to be better. Their approach is going to be better. Their compliance with medications is going to be better. So we need to strive for that. So whatever life puts at us, and if we have a physical ailment, we need to try to strive for these different things. And if identify also those that might have more of a negative, let's say, emotional vitality or needs work in that area, to try to work with them, to strive them to be more positive, to get out of that role and to be able to empower themselves to start exercising, look at things a little bit differently if available. And I think this also goes back. I'm a father of four children, and it goes back to trying to teach our next generation to have those coping skills to be able to deal with all these different types of stressors that are going to have them later on in life. What is the link between ADHD and cardiovascular disease? Um, there has been, in one of the studies from Sweden, they showed that there was actually a twofold increase in risk in this, and of patients having coronary disease. This was cardiovascular disease later on. It was more of an observational study. And usually because patients with ADHD in some occasions might have other forms of mental health issues such as anxiety, depression, and so on and so forth. And ADHD, remember, it's a impulse control situation with mental health. Discuss ways to improve psychological health and how these recommendations can impact cardiovascular health. So some ways we can actually improve our psychological health is being more engaged, being more positive, um, doing physical activity. If we need medications, being on the right medications that'll help us guide us through these processes, and also sometimes seeking the right help. Not being afraid to say, I need help at this time in my life. And to be able to talk to a therapist, for example, reaching out to them to be able to get the guidance and the help that we need. And a lot of times, what we see, and I've seen, is that they will give you tools to be able to cope with those different realities that you're living in life, which is a great aspect. So it's extremely important. Again, this was taken from the internet. Some of these slides were from the American Heart Association journals circulation. This one was taken from the internet as well. And I thought this was not only cute, but also kind of emphasizes the point that the heart and the brain and the body don't go in separate directions. They're interconnected highly, and we need to be able to think about these things when we're see an individual, either a family member or a patient, to be able to guide them in this process. And I think I'll open it up some questions, Dr. Coleman. I hope that covered a lot of the different aspects. And again, if anybody has any questions or we can be of service, we're here to serve our community, and it is an extreme privilege to do so. So please feel free to reach out to us here at Jackson North Medical Center or any of our locations in West, South, or Maine, if we can be of your service.
Absolutely an amazing presentation, Dr. Rivera, and we're so grateful. Listen, we gave you those questions and you did not miss a beat, and we're so grateful for that. One of the things that really encouraged me as a healthcare provider for over 30 years and critical care nurse, you talked about a little bit how we kind of separated things in. The cardiologist did the heart, the neurologist did this, but you married them today to let us know that it is important, that it's interconnected. And I just really, really love that piece there. And the other piece, and we're also looking to see if there are any questions that came in our chat. But the other piece that you built upon, when we think about building a healthier tomorrow, we know we're in a maintenance stage post this COVID era, but
Yeah.
our children are so very important. So I love the fact that you brought up how we need to educate our children in a more proactive way regarding how important our mind and our heart and all of the other organs, but we're specifically talking about those two on today. So I don't know if you wanted to share anything in this post-COVID era that you might have seen in your work where there's an increase or flare-ups around cardiovascular disease, because we were all shut down for so long, and now coming out, I'm quite sure there may be some differences that might have been seen. If you
Yeah,
want to share.
I saw actually when in the during the COVID era, part of it I was in my cardiology and interventional cardiology training, and we saw how patients were reluctant to come out of home, and how it affected their health overall because they were afraid, they're distraught, they didn't know what they were dealing with if they went out of the house, and knowing that they had cardiovascular disease already put them at a higher risk for mortality and other things. So it affected them quite significantly. um, a lot of times we've seen patients now it's doing better, but that wouldn't come, then didn't get their medications for one reason or another, or were afraid to go even to the pharmacy. So it had a big effect on cardiovascular health. We also saw a decrease in number sometimes of myocardial infarctions that would come into the hospital with chest pain, because patients were afraid to come to the hospital because they knew that there was a high incidence of COVID. And again, this was more anecdotal than actual proof of numbers that I have. Um, but it's important, I think, for the community to realize if you need help, if you are having chest pain, if you feel that your mental health is being affected, we're here for you. So it's not only Jackson, but all the other healthcare institutions that we have around the US and around the world. Please seek out for help. That's why we're here.
Absolutely awesome. And I'm grateful that you brought that piece of seeking out the health. You talked about the quality of life, and that's one of the things that's my mission is to promote what I call abundant life, which is the same thing as quality of life. And I highlight and echo that even in caring for patients myself, I would see two people with the same diagnosis, right? And the prognosis, but yet it was their mindset, whether it be tied into their faith or just how they view life. When you're more positive, the outcomes are much more in your favor. And so I like that you brought that piece out. And so we're grateful. We see that Peggy Woodside is on there and said, awesome. This is very important. We have our audience engaging with you and thanking you for your expertise. We see Louise. Yes, absolutely. Champions of health. And we're grateful for this information on today. As we're sharing, and almost because our time was so valuable, but it's coming to an end, we want to know if there are any final nuggets that you want to share to encourage those who are on and those who will see this a little bit later around heart health and mind health.
Yeah, I would say we're here for you. Each one of the healthcare providers over Jackson Health System and many other institutions, we are healers in general, I think, and we're here to provide that healing in many ways, not only in the physical aspect, but again, mental health aspect as well, because these things are not separate. They are together, they're interrelated, and one thing can affect another. There's one thing I didn't mention, and that's one example of how a stressful situation, depression, anxiety can affect the heart is in a common condition called Takotsubo, which it's a lower population or prevalence in our community, but it can affect the heart so much that you can end up with heart failure, and it might look like an acute coronary syndrome. But again, it's not the more common thing. So if you are having chest pain, if you're having shortness of breath, or you're distraught, if you feel that you're distraught emotionally or mentally, please seek out the help. We're here to provide you with any support that you're needing.
Awesome, awesome. We're grateful, and I'm so excited because I am a champion of the 10 dimensions of health. We always think of just the physical body, but it's spiritual, mental, emotional. You talked a lot of, about that, intellectual, and then of course looking at our physical body. And there's so many other things, like financial, our environment, all of those things. There are 10 dimensions, but when we don't get them right, we thank God for the 10th dimension, which is the medical dimension, which we have Dr. Rivera here with us, and also a champion there. So we're grateful. We see Beatrice sharing excellent information. Thanking you, Dr. Rivera. So is Geraldine. And so we're grateful for them sharing, and we're grateful for your expertise, and also grateful for the Live Healthy Miami Gardens initiative. And so we're going to sign off on this week. And again, we're grateful, grateful, grateful for all that you do to make a difference in the lives that you get to touch and serve.
And Dr. Coleman, thank you so much for this initiative. It's fantastic, and kudos to you for doing this and the team.
We're excited. That's what it's about, making a difference. All right. Thank you so much. And thank you for those of you who've joined in with us. We'll see you again next week, 3 o'clock, for some more information to make sure that we have all that we need to be healthy, mind, body, spirit, and soul. See you all next week.